My name is Athar Muniruddin Siddiqui. I'm a spinal and orthopedic surgeon who started working in Dr. Ziauddin Hospital. A spinal surgeon can be a neuro or an orthopedic surgeon who is cross-trained to deal with the complexity of the neural tissue and the bony anatomy of the spinal canal. He can work all the way from the cervical spine, which is the nape of your neck or the back of your neck, down to the tailbone, which is the sacral spine. The most common complaint a spinal surgeon should encounter is low back pain. In developed world, it is the most common cause for calling in sick. Majority of the patients that come to us either come with a disc prolapse from cervical or lumbar spine or back muscle spasm. Other rare causes can be traumatic injury to lumbar spine or low back, RTA, road traffic accident, causing injury to cervical or lumbar thoracic spine, or in developing countries like Pakistan, tuberculosis of spine or Pott's disease. Generally in our clinic, patients that back pain is not resolving given appropriate time frame, patients where they develop tingling or burning sensation going down their upper or lower limb, patients that develops loss of function in their upper or lower limb, patients with loss of bowel or bladder control, or patients that develop progressive deformity that requires structural correction. The most common treatments offered, contrary to popular belief, 90% of our patients get treated with lifestyle modification, pain management, back physiotherapy, and so on. Only in 10% of cases where symptoms are not resolving, we offer surgical intervention. Non-operative managements include nerve blocks, facet blocks, epidural injections, targeted nerve blocks, core targeted physiotherapy, and other pain management modalities. Surgical option varies greatly from simple microscopic surgical decompression to complex deformity correction using rods and screws. Okay, in expert hands, spinal surgery is over 90% safe. There is always some risk of complications in any surgical intervention. However, the benefit one gets out of that surgery should outweigh the disadvantage. So, trained surgical opinion is the key for safety. A person not trained enough to perform similar complex surgeries, yes, there is always more likelihood of complications, including paralysis. However, in trained surgical hands, the chances are minimum or almost to none. People who are symptomatic of neural tissue or cord compression, which is evident on their scan, can benefit from injection or surgical intervention depending on the severity of their condition. Recovery time varies from patient to patient, but as a general rule of thumb, it can be from 6 weeks to 3 months. Again, depending on the severity of the case, complexity of the surgery, there can be long-term non-disabling back pain that can be managed very easily with lifestyle modification. Generally, we advise our patients to be as mobile as possible immediately after surgery or at the most 24 hours following surgery. We ask them to stay indoors till their stitches come out, which is around 2 to 3 weeks time, and following that, extensive targeted rehabilitation or physiotherapy can make them mobile as time goes by. As a general rule of thumb, again, the rehab should continue for around 3 months to 6 months to give them almost full muscular strength that plays a really vital role in their day-to-day life. Last words, prevention is better than cure. Weak abdomen, combination with weak back muscles, coupling with sedentary lifestyle, bad food, increases tension on your back and makes you a subject for back pain. My advice is to exercise at least 30 minutes, 3 times a week. That will flatten your stomach, increase your core, strengthen your back and ease tension on your back ligaments, discs and bone. This will help you to cure your back pain yourself. Irrespective, if not better, we are here for help.